Hello, today I'll be explaining the brainstem respiratory centers, which is what controls the automatic unconscious cycle of breathing. There are three pairs, one of each on the right and left sides of the brainstem. The communication of the two sides allows for the respiratory muscles to contract symmetrically. First we have the ventral respiratory group, which is an elongated nucleus in the medulla with two commingled webs of neurons, the inspiratory or I neurons and the expiratory or E neurons. For example, during quiet breathing, the I neurons fire and issue nerve signals to integrating centers in the spinal cord. Output from the spinal centers travel by phrenic nerves to the diaphragm and by intercostal nerves to the external intercostal muscles. Contraction of these muscles causes inspiration. Eventually, the I neurons stop firing and the E neurons begin firing. The elastic recoil of the thoracic cage expels air from the lungs, causing expiration. And this cycle continues on. The dorsal respiratory group is another web of neurons that extends much the length of the medulla between the VRG and the central canal of the brainstem. Breathing can be fast, slow, shallow, or deep, and it's always changing, so that's where the DRG comes in. It receives and processes information from multiple sources, and then issues output to the VRG that modifies the respiratory rhythm to adapt to different conditions. Last but not least, we have the pontine respiratory group, which is on each side of the pons, and it modifies the rhythm of VRG. It receives input from higher brain centers and issues the output to both the DRG and the VRG. It adapts breathing to special circumstances such as sleep, exercise, or emotional responses.